Every baby needs a full oral examination. If a frenulum is present, is compromising tongue function and deemed to be the underlying cause of the difficulties, the frenotomy should be done as soon as possible, quite often at the same visit.
We've been having some problems in the last 2 months. He's been waking up, I'd say, every 30 minutes to an hour and a half, wanting to eat, and doesn't seem to stay on my breast for very long. He seems to get tired, really worn out, and sort of give up after.
As soon as I try to put him on the breast, he tries to latch, he opens up, and then he comes down, and he might suck for 2 seconds, and then I think because of the sort of trying in the jaw, or trying in his mouth, he goes right to sleep, comatose.
Oh.
And so that is a real struggle because I can't even keep him awake to try and suck, right?
Although his tongue looks fine to us, we're used to that front tongue tie, and we just thought it was worth the drive, and so thank you for seeing us.
Oh, my pleasure. Frequently, parents are surprised their baby is tongue-tied, either because they have not heard of it or because they have been told otherwise. Usually they are relieved that there is a concrete reason for their difficulties and that it can be immediately corrected. Many mothers have felt like a failure as they have expected breastfeeding to be easy and natural. Now something simple can be done to provide them relief and help their baby thrive. The anterior tongue tie is more obvious. It can be seen even more clearly when the baby lifts the tongue. The frenulum is usually a translucent, that is, clear membrane in the midline. It may go part way to the tongue tip or all the way to the tip. On the other hand, the posterior may not be easy to see. It may simply look like a short tongue. Advise parents that there may be a few minutes of stinging pain and a few drops of blood. When frenotomy is carefully and correctly done, there should never be heavy bleeding. Here is another central clip with another snip on the right where tension remains. Analgesia may be helpful for the baby. I mentioned to them that the diamond-shaped wound will normally change colour to white, creamy or yellowish, a natural healing patch, not an infection. So how are you feeling about the situation right now?
I'm so happy. With a couple of adjustments, she seems to be getting the hang of it. And it's easier for Chad and I, my husband and I, knowing that she's able to get nutrition from me as opposed to somebody else.
We came in with clicking at the breast, and she was going about only about 2 hours between feeds. So Dr. Jain's nipped the tongue tie, and there's no clicking at the breast, and she's very comfortable. So we hope over the next few days we can get a few more than 2 hours between each feed.
How is it feeling now?
Amazing. This is the first time he's latched on for more than a couple minutes in a whole week, so which is good. And I think the latch is even sort of stronger, and I can see his big sort of chin pulls here, so he's really getting it.
Good.
Yeah.
Good.
Yeah.
All right. Any swallows yet?
Yep. Oh, absolutely. There have been. Right. Probably from the first 30 seconds.
We were close to giving up and thinking, gosh, this isn't going to work.
Right.
Just knowing that something so simple can help facilitate the process is huge.
Yes.
You're famous.
Well, and he's moving his tongue around. Oh my gosh. I don't think I've ever seen him move it side to side. I've never seen that.
And it doesn't hurt nearly as much. Yeah, and his eyes are still open. He's still awake. Normally he would have given up and went to sleep.
I don't feel that like the gum mashing action. It feels like more of a soft, from what I've heard, what it should feel like without any tension or pain or anything.
Mm-hmm. Mm-hmm.